Hello and welcome to today's webinar, To Pee or Not to Pee, a Senior Pet Dilemma, co-sponsored by Henry Schein Animal Health and PRN Pharmacal. Before I introduce our speaker, I want to remind you may submit questions throughout the webinar in the questions pane of your GoToWebinar panel. We'll have a question and answer session at the very end of our presentation today. We're very pleased to have Dr. Heidi Loebpreis with us today. Heidi Loebpreis, DVM, is a veterinary dentist that has been a member of the Main Street Veterinary Hospital medical staff since April of 2010. Dr. Loebpreis says she knew from age 7 that she wanted to spend her life as a veterinarian simply because she has always loved animals. She began her journey toward her current career at Texas A&M University, where she earned a Bachelor of Science in Biomedical Science in 1981 and her Doctorate of Veterinary Medicine in 1983. Her areas of special professional focus include dentistry and senior care. She's also a diplomate of the American Veterinary Dental College. Dr. Loebpreis and her husband Joe have a greyhound named Buddy and 3 cats, Ella, Spot, and George. Dr. Loebpreis's interests include cycling, hiking, and reading. Please join me in welcoming Dr. Heidi Loebpreis.
Thank you, Amy, and welcome to everybody out there. My name is Heidi Loebpreis. And while my dentistry is my primary field of specialization, I also have a strong interest in promoting the health and well-being of our aging pets, both through dentistry and the myriad of issues that can be found in this population. One of the dilemmas that can face senior pets and their owners is urinary incontinence. So, to pee or not to pee? To pee or not to pee, that is the question. Whether 'tis nobler in the mind to suffer the stains and puddles of outrageous incontinence, or to take meds against the bladder of troubles, and by opposing them, end them. To sleep, perchance to dream, without wetting the bed. So Shakespeare is likely rolling over in his grave right now, but I just couldn't resist that. So let's get started with this theme of that is the question for our webinar today. As we look at the agenda for our webinar, we will discuss how questions in a veterinary practice are essential in collecting information we need to know about our patient. We'll narrow this down a little bit when we look more closely at senior care issues and how their quality of life is important to maintain that strong human-animal bond in the family and what questions can help this bond. Then we'll dive even deeper into specific questions that deal with urinary issues, specifically urinary incontinence. Now that we've set our agenda, let's have a little fun. Today, we're going to have some audience participation with polling questions. So let's break the ice with a question about how your day at the clinic was yesterday, or the last full day you were there, with everything you have to do, including asking and answering questions. How was your day? So with this wine glass, or you can drink tea or lemonade, whatever you like, we're going to see if you had an easy day, a rough day, or don't even ask. Now for the polling question. So, that glass, are you going to have a light pour? Was it an easy day? And you can just click on one of the questions, one of the answers. Maybe the questions were straightforward, maybe nothing too unusual, or you even had a puppy or kitten for that day. B, maybe it was a rough day. There were a couple challenging cases, some pretty interesting questions or clients, but you know you made it through. Or you need a very generous pour and don't even ask. You know, we've all had those days. Go ahead and relax. So go ahead and submit your poll answer, and we'll see what kind of day we've had lately. So what we're going to do is go ahead and see how everybody's day was with the end of the poll. So 61% had an easy day. That's not too bad. 28%, 26% had a rough day, and for those 13% don't even ask. We've been there, we know what you're feeling. Today and tomorrow is another day. So let's go ahead and proceed with our seminar. In your practice, have you ever stopped to think how many questions you ask or answer? For a typical wellness exam, The questions are going to differ from more targeted questions you ask due to an illness or injury. And how about the questions your clients ask? I had one pet parent the other day who prefaced hers with, "I have a few dumb questions." And you know what? They were pretty good, although I've heard the dumb questions before. And somehow I think you can tell if they've been Googling before they got there by the questions they ask. But what about the questions that go unasked, either due to a lack of awareness, a sense of complacency, or even embarrassment maybe by the owner? The questions that go unasked never get answered, and that's why it's so important to have good questions. Think about the questions you ask during these different exams. There can be a huge variety of questions asked for a wellness exam, and even more questions if there's a particular condition you need to find out about. If you have a pet that is new to your practice, there are many areas that need to be addressed, from vaccination status to parasite coverage and diet to even past medical and surgical history. A young patient, like you have with the first kitten or first puppy exam, needs extra time for all those questions and the discussions you need to have. The exam for a mature healthy pet, maybe for vaccine updates, might be pretty uncomplicated and routine, especially if there's minimal changes going on with that pet. But as our patients age, we need to increase the level of awareness, education, and even surveillance and monitoring with these clients for all of the potential issues that can face our patients. Let's look at how we manage some of these questions. It can be helpful to have a checklist or questionnaire to cover evaluation of all the body systems. Just be careful not to just check off the boxes quickly and potentially miss something. Getting better details in the patient history can also be facilitated with a good questionnaire. It might ask the owner questions about the diet and potential health issues, including GI or urinary problems, and even behavioral issues. So let's go to our second poll. As you look at what your clinic does with questionnaires and health checks, we're going to let you choose one of these selections. And if we didn't quite get what you do, you can select other. So, for does your clinic utilize specific health check questionnaires? We try to have for every patient, or we have a checklist for specific disease presentations. We may ask questions based on the presenting complaint. Maybe we're trying to be a little bit more consistent on asking questions, or other. So let's go ahead and answer that question, and then you can click on the button that pertains to you and submit your answer. Let's go ahead with the quick poll now and see what our response has been with everybody who responded to this question. So as we look for utilizing specific questionnaires, we asked questions based on presenting complaint. They come in with a lameness. You find out how long it's been going, which leg seems to be lame. We try to do it for every patient, 19%, and 14% trying to be more consistent on asking questions. And you know what? That just takes doing it over and over, making it a normal part of the procedure to get those questions asked so you can get the right answers. So now we'll go back to our seminar slides talking about questionnaires and health checks and overlooking some of the senior issues when we maybe don't ask the right questions. Gathering information about senior pets can be critical in identifying problems at early stages because many of these conditions may have pretty subtle changes. The parent may not recognize these changes and they may not realize the importance of these. Maybe they think their pet is just getting old. But these early signs can be discovered by asking the right questions, or certainly by examining these seniors on a more regular basis with appropriate diagnostics as needed. Many of these conditions, from osteoarthritis, weight change, dental issues, cognition, and even urinary issues, can be managed earlier to help minimize their impact on the health of the pet, because we want to optimize their health for as long as possible. That way we maximize their health span, not just the lifespan. Because as we look at the length of life of our senior pets, it's more than just numbers. It's about the quality of life. If the changes we're talking about aren't identified early, from their obesity and osteoarthritis to renal function and urinary incontinence, the progression of these diseases can advance beyond our abilities to help effectively. A decreased health span with complicated issues that strain the human companion-animal bond may lead the owner to abandon their pet or put them up for adoption. It's unfortunate but true. Other pet parents come to the decision that their pet's quality of life has diminished to the extent that euthanasia seems the best option, and often it is. There are many health issues that can impact our senior pets, but we're going to look more closely at some urinary issues now. From a broad perspective, finding problems with urination can open up the door to a host of problems. Asking the correct questions can help gather information about the amount of urine, sorry about that. Is there polyuria, but is there also polydipsia? We'll ask about frequency of urination. Is there an appropriate urination, with or without a change in volume or frequency? Or is there incontinence, which usually implies a subconscious or unconscious voiding? So let's look at PUPD first. If there is true PUPD, it's essential that a complete medical workup is done, obviously. Blood work, urinalysis as a minimum database is extremely important. Additional diagnostics to key down to specific diseases, whether it's Cushing's disease, diabetes, or renal disease. And then we find that underlying condition, certainly we must manage it appropriately. If the total volume of voiding urine is not necessarily excessive, but the pet is straining to urinate small amounts frequently, then several conditions need to be ruled out. The presence of infection, stones, or tumor can certainly stimulate an increased frequency of voiding attempts. In addition to the minimum database, imaging with radiographs and ultrasound, as well as cytology and cultures may be needed. Even a voiding assessment, watching and seeing how the pet voids urine. And don't even get me started on feline cystitis. That's an entirely new talk altogether. So, when there's an inappropriate urination, if we have these episodes of house soiling, we need to examine all of the medical aspects covered earlier. Is there truly an increase in the volume or frequency to the extent that the pet can't hold it long enough and has to avoid in the wrong place? Or if osteoarthritis is an issue, is it too painful to make it through the doggy door or over the rim of the litter box? Now, submissive wetting has a behavioral component, and inappropriate elimination can be an indication of cognitive decline. Of course, behavioral intervention may definitely be needed for those pets who deliberately use urination just to get their point across, and we've all known a few of these. But as we move past some of the other medical and behavioral issues, now we're going to talk about urinary incontinence. One of the key points in the assessment of urinary incontinence is to determine if the voiding is during a conscious or unconscious phase. If it's in a young patient, the presence of ectopic ureters should be ruled out. For any patient with other neurological issues, disease in the caudal spinal cord needs full assessment. Decreased sphincter function itself is typically to a breakdown in a complex response from a decrease in the response and tone of the smooth muscle of the sphincter to degeneration of periurethral structures. And that can lead to USMI, urethral sphincter mechanism incompetence, another acronym for us to learn. As we look at USMI, we see that it's been reported in up to 20% of spayed females. In some dogs, the urethral closure pressure is reduced within 1 year after spaying, and typically it is seen within about 3 to 10 years of being spayed. While some studies show a decrease if they're spayed before their first heat, other references show an increased risk if spayed under 3 months. And then if spayed after the first heat but before 3 years of age, there tends to be an increased incidence. Most often it shows within a few years, but we may be more aware of it as our pets age. It may have even been present for months to even years before owners seek help. And as it advances, the leaking may even occur when recumbent or after exercise. Certainly the poster child of USMI is that dog over 20 kilograms, with certain breeds pretty well represented, such as Goldens, Labs, Huskies, Newfoundlands, and Bulldogs. When we look at the numbers for urinary incontinence, it just doesn't add up to some good numbers. Just think of it. Up to 18.5% of dogs in shelters were relinquished due to house soiling. Now that number is not broken down into those due to USMI, but any chance to impact that statistic is important. So we need to realize that some of these may be in that case. Other behavior issues may be identified as well. We also just discussed that up to 20% of spayed females and up to 30% of those larger dogs may be incontinent, but only 2% of dogs are brought to clinics because of urinary incontinence. So guess what? We may be not recognizing or at least underdiagnosing some cases. So we need to ask the right questions. For both pet owners and veterinarians, we need to start that discussion. And there's a good resource at www.cuhi.org. That's Canine Urinary Health Initiative. And you can feel free to go there once the webinar is over. It has some downloads you can use, FAQs for pet owners, and information about behavioral conditions, medical conditions, and urethral sphincter incontinence. So, are we asking the right questions? What should we ask? Focusing down to a specific question like, does your pet wet the bed, may not be practical at every visit, and certainly not for every pet, but a more general inquiry about elimination, both urination and defecation, can open up the conversation if there are issues. On exam, if you notice red or irritated skin around the vulva or excessive licking in that area, as mentioned, then incontinent leaking should be ruled out or investigated. An increased frequency of urinating necessitates a full workup, as previously discussed. And while no study has shown a specific increased risk of urinary tract infection with incontinence, it is suspected that lack of urethral closure could contribute to ascending infections. So make sure you investigate everything well. So what causes incontinence? There can be a number of reasons that cause urinary incontinence in dogs, from congenital anatomic abnormalities, tumors, polyps, nerve injury. They can all cause it. Urinary tract infections or bladder stones may also be a cause. However, the most common form comes from USMI, urinary sphincter mechanism incompetence. A full exam should also be used to rule out other causes, including the lab work and comprehensive history, to make sure you look at any other contributing factors. Urine is normally prevented from leaking out by the band of muscular tissue at the base of the bladder, the urethral sphincter that acts as a valve. This is supported by the periurethral connective tissue as well. We know that certain hormones are important in control of this valve because estrogens can contribute to the integrity of the smooth muscle, mucosa, and connective tissues. Decreases in these hormones can cause weakening of the urethral sphincter, causing USMI. These weakened muscles can allow urine to leak out, often while the dog is lying down or sleeping. With estrogen deficiencies, it's likely the lone cause for incontinence. In fact, while administration can help indirectly increase urethral closure pressure, possibly by sensitizing alpha receptors to catecholamines, but there are side effects with hormonal therapy, and not every dog will respond. The key is looking at the role the sympathetic nervous system plays in urethral closure pressure. The alpha adrenergic receptors in the bladder neck and urethra stimulate the smooth muscles of the sphincter. These receptors are type 1 alpha receptors, and we'll see where this is pretty important. Proin phenylpropanolamine, PPA. It's a selective type 1 alpha agonist. While related to ephedrine, this selectivity is important, as ephedrines are type 1 and type 2 alpha and even beta activity, resulting in significant side effects, as well as the fact that they can be habit-forming. In fact, issues with ephedrines were a critical reason PPA compounds were removed from the market years ago. The selective activity of Proin is why it is a common solution for USMI. As you can see in the diagram, over time certain dogs are prone to a weakening of the sphincter muscle and connective tissues as previously discussed. They may have problems controlling their urine. In other words, they start to leak. The pudendal nerve pictured as part of the somatic nerves, and while not pictured on this specific diagram, the hypogastric nerve provides sympathetic innervation to the smooth muscles, the non-voluntary sphincter. The pudendal nerve is part of the somatic local reflex that stimulates striated muscle to contract in response to a sudden increase in abdominal pressure and bladder pressure, such as when you cough and sneeze. You youngsters out there, you'll understand this later in life. The pudendal and striated muscle is also important for sphincter relaxation for conscious voiding. When Proin is added to the mix in the treatment plan, it focuses on stimulating the urethral smooth muscles and tightening the muscles that tend to loosen over time. This keeps urine in the bladder into the appropriate elimination time, thereby reducing involuntary leaking and sometimes completely eliminating it. Twice daily Proin, when given as prescribed by a veterinarian, decreases urinary accidents by 82% over a 28-day period. This should be pointed out that the accidents were counted starting on day 1 of therapy, and we know that it may take a few days to a week for Proin to reach a satisfactory level of efficacy. With continued dosing for 180 days, over 98% of pet owners replied being satisfied by the control of urinary incontinence in their pets. And certainly, we know that more than 90% of American veterinary practices carry some of these urinary health products. So let's go to our last polling question for today. Let's look at how your clinic manages the incontinence cases. So as we go to this question, does your clinic use Proin as the first choice in cases of USMI, urinary sphincter incompetence, muscle incompetence? So go ahead and select your answer and submit your question. And we'll give people a few minutes to go ahead, a few seconds rather, to go ahead and select it. 50%, yes or no. Is it your first line of choice? Okay, let's go ahead and look at what our responses are. Yes or no. 70% yes and 30% no. Well, that's a pretty good response. So let's go on and look at Proin in your practice. Proin is pretty easy for pet owners to administer because of its long recognized palatability. In fact, there was a change in the package insert that the FDA requested of PRN Pharmacol to include a warning against dogs who will actually chew through the bottle to get to the Proin. if the bottle's left within reach. And the bottles were also reinforced, but keep it out of their reach. This is pretty palatable stuff. Proin also offers precise dosing options with 3 sizes of scored tablets, allowing veterinarians to tailor the dose to the size of the dog, minimizing the adverse events, and giving the flexibility to increase the dose if needed. Proin is indicated on the label for control of canine urinary incontinence due to urethral sphincter hypotonus. Proin is the first only FDA-approved phenylpropanolamine with proven efficacy and history of success. Now keep in mind, in some pets it typically takes 2 to 4 weeks for Proin to cycle into the pet system and begin producing results, and it needs to be given continuously to ensure desired results are achieved. Now, with every product information, I know those can be some long sheets with small writing, but there's always important information. On here, you have to remember instances of dogs chewing through closed vials of Proin has been a problem with overdose, so keep the bottle in a secured storage area. And one of the important things to remember is that a type 1 alpha agonist can also impact receptors in blood vessels. Some of the most common side effects in people relate to increased blood pressure and can include headaches as well as strokes and heart attacks in extreme cases. Again, one of the reasons the PPA compounds were also removed from the market. The increased blood pressure has not been identified as a clinical issue in dogs when given the proper dosing levels, but care should always be taken with any patient at risk, including those with high blood pressure, existing heart, liver, kidney disease, with diabetes or glaucoma. So watch out for those high blood pressures and just be cognizant of the issues that might happen. As we look at those tough cases of urinary incontinence, maybe the ones that don't respond as well initially, or the ones that did respond, and now we're having issues with incontinence starting back up again. Please remember to repeat the full diagnostic workup. Additional urinary problems may have cropped up in the meantime, compromising the management of the continence. Also, the dose and frequency of Proin may need to be increased over time to maintain continence. There have been studies looking at the effects of a gonadotropin-releasing hormone therapy, a vaccine. As estrogens decline, elevated FSH and LH levels may also have an effect on the bladder, although no real effect has been shown on the urethral pressure levels. As we look at the options of estrogen therapy, since the modes of action of Proin versus estrogen replacement are different, it's not quite apples to oranges. Now, the estrogens may sensitize the alpha receptors, so that may be where they help out as well. And while no true synergism has been proven, anecdotally there's a number of patients that will show improvement, so it's probably worth a try. Just always keep in mind the effects of estrogen therapy, and then consider using it in conjunction with Proin. For those really tough cases, then there are some surgical options, but we're not talking easy stuff here, typically. With copal suspension, most patients will have improvement and up to 50% will become continent. With urethropexy, there's a much higher rate of complications, and then other options such as collagen injections may be done to help shore up the sphincter continence, but initial results can deteriorate with time. Botox has even been proposed as a potential treatment. The key is surgery is often quite invasive, and it often has poor long-term efficacy. So hopefully your medical impact will be enough for your patient. As we start to finish up, remember some of the best practices when using Proin. Make sure you rule out other urinary issues, both at the beginning and even during if you have any refractory cases. Urinary tract infections, other cases of PUPD can all exacerbate incontinence when present. Make sure you check the blood pressure before starting the Proin and then about 2 to 3 weeks later, especially if you have any concurrent renal disease, glaucoma, Cushing's disease, and issues with blood pressure levels. And then certainly you're going to monitor your patients closely. Sometimes you'll need to increase the doses that you're using or the frequency, and in some you may decide to add in the estrogen to enhance the response. The key is getting to these problems early with good questions and good evaluations so you can maximize the response of these patients to your treatment to help keep them from being too leaky. So now I'd like to find out if we have any questions out there, and I'll turn it back to Amy.
Great. Thank you so much, Dr. Low-Price. This has been really fascinating and educational. We do have a few questions coming through right now. And remember, anyone out there, you can ask any questions you like. Our first question is, would you go with estrogen in both genders?
The trouble with estrogen in both genders is you can have those hormonal changes. So in certain cases, it may be something that can help, but I'd certainly alert the owners to let them know to watch out for any of the changes.
All right, great. Someone else asked, I have heard that any of the urinary incontinence products, whether Proin or estrogen, are not 100% effective 100% of the time. If the dog I'm treating is not responding, what would you suggest?
Oh boy, I wish I had a practice that I could do 100% effectiveness for every situation. We know it's not going to be 100%, but you start out ruling out other conditions, starting with your doses, and then working from there to increase the dose if you need to, or adding in the estrogen if you started with the Proin, and from there make sure you didn't miss anything. If you really need to, then you can consider the surgical options.
Okay. Someone else wants to know, how quickly will they know if Proin is working?
In most patients, I think you're definitely going to see a change within a week. I would say give it a good 2 to 4 weeks to be on the safe side. I know of some patients that within a few days, they at least had a decrease in the urinary incontinence issues.
All right. Let's see, our next question, more about estrogen. What kind of changes with estrogen in both genders?
When you give the estrogen compounds, any changes with the vulva, with the breast tissue, they may start attracting males, things like that, are usually minimal, but it can be a problem. Usually we only get bone marrow suppression with higher doses, but that is something to check if they're on any kind of hormonal therapy.
Okay. Do you recommend starting at a lower estrogen dose and then estrogen alone if the dog's already on Proin?
I would definitely look at the lower dose, if at all possible, and see if that's going to be enough to help supplement the Proin. From there, you might have to work. I know some cases that we've gone up to 3 times a day on the Proin and just watch them closely with the blood pressure issues as well.
All right. The stated success rates with Proin were in dogs balanced by gender or in mostly females?
Since the USMI problems are mostly in females, that's where most of our data comes from.
All right. Someone else would like you to explain the gonadotropin-releasing hormone immunization again.
Now, I'm not real sure of the availability. I do know years ago there was a vaccine to help with prostate hyperplasia, but white papers were available to show that GnRH helped decrease incontinence. Looking at the FSH and LH, that very balance between the hormones is what may impact the continence issues with these patients. I don't know all the details for sure, and if you want some more information, we can try to get some for you. I know there are a couple references out there.
All right, great. We have one final question for today. Someone's concerned about using a PPA product in a hypersensitive dog. What do you recommend in that case?
Whenever you have a dog that you have concerns about, you always start at a lower level and you monitor them very closely. You might not wait for 2 to 3 weeks to recheck the blood pressure. If the owner calls and there seems to be a problem with administration or shortly thereafter, have them discontinue it and recheck the patient. But typically, we can see things, everything from a little GI upset, some diarrhea sometimes, but it's typically pretty minimal.
All right, thank you so much, Dr. Loeb-Price. This has been a really great presentation, very educational, very informative. I'm sure everyone in attendance has learned a lot today. To everyone who's attending, do note there are 2 handouts in your GoToWebinar panel. Be sure and download those before you leave today. Thank you again for your attendance and attention. This concludes our webinar presentation for today.